Hello again, and welcome to part 2 of COPD. So this time we're going to look more into the treatments and what you can do going forward with COPD. Ooh, let's see. There we go. All right, so remember when we're looking at COPD, we're really looking at the oxygen exchange and what your ability is to do that exchange and blow in and blow out during exhalation of CO2. So remember, inspiration is when you breathe in, that diaphragm pulls down, and then as you expire, so as you breathe out, that diaphragm pushes up and pushes the lungs in, and you escape that air. Okay, so one of the treatments of COPD is oxygen therapy. And so there are multiple different types of oxygen things. When you guys come to class, we use what are called E-cylinders. Those are the little green top tanks, and you can see a picture of those right here. You can have a home concentrator, which is what a lot of times you'll have at home. You have portable concentrators. So those are the ones that you can actually strap on, take with you, and they have a little bit amount of flow. And usually these are all used with a nasal cannula. So oxygen in the air is 21%, and when you put on supplemental oxygen, which is what all these machines and things do, you can actually increase the amount of oxygen that you're breathing in from the air, because what you're breathing in then is 100%. You're not breathing 100% oxygen because you're still getting an ambient air as well. You're just increasing that from 21% to a higher ratio. So you've got continuous flow versus intermittent flow. So when you are on an E-cylinder, those are definitely going to be continuous flow. So that means there is free oxygen flowing all the time. Intermittent oxygen or intermittent flow is, we also will call it pulsed flow, is when it will only release the oxygen when you breathe in. So it is stimulated by that inhalation. So if you are a mouth breather, it's not going to work as well. So that's why it's so important that we have taught you how to do the pursed-lip breathing. So in through the nose, out through the mouth, and it's about a 3 to 4 count in and a 4 to 5 count out. So, or 2 to 3 count in, 3 to 4 count out. So it's a nice slow inhalation. We're using your nose and blowing out through the lips. And that's why it's so important that you do that, because you are stimulating it through the nose by breathing in, because that's where that nasal cannula is. If you are breathing through the mouth, you're not breathing in any of that supplemental oxygen. So one thing to kind of keep in mind is a little bit of safety. Make sure you stay away 5 feet from an open flame, and that includes grills, gas stoves, campfires, anything where there's a fire that can be started, because oxygen is flammable. Order for oxygen includes an exercise prescription or a physician prescription, as well as the amount of liter flow. So your physician's the one that's going to tell you whether or not you need oxygen and whether or not you need to increase your flow or decrease your flow. Now, when you're in rehab and we are watching you exercise, we have clearance for you to breathe up to 4 liters. On oxygen. So we may increase that amount of oxygen that you're breathing with exercise, depending on what we see your saturations are doing. So, but your doctor is the one that prescribes that for you. All right, so the nasal cannula is that little thing, and you can see it in the picture right here. That goes in, the prongs go in your nose, and then you're able to breathe in. So it delivers from anywhere between 24 to 44%. So that's why I said that we increase that amount of air that's flowing in there from 21% to higher. And you can see in this little chart here what those percentages actually rate off to. So there is a maximum flow for children of small kids, because we don't want to increase them too much. And then if you get over 6 liters of oxygen that you're needing to take that in, you need a little bit of humidification. They also make higher flow nasal cannulas that give you a little bit of a reservoir. So it makes it a little bit easier, because if you're over 6 liters, you can really tend to dry out your nose, and that's not a very comfortable feeling. All right, so portable oxygen container. So this is concentrator. So this is the one that you can take with you when you are exercising or when you go to the store or anything like that. And it's a little bit more portable and a little easier to handle than a small tank or anything. And oftentimes the portable concentrator will last you a little while. Most of their batteries are designed to last up between 4 to 8 hours, depending on which one that you get. So what they do is they take ambient air, which is what we're breathing right now, and they compress it in the concentrator and then increase the amount of air that's in there. So it takes the nitrogen away, and so that way when you're breathing it in through the concentrator, you're getting a higher amount of oxygen in there. And so it's continuously, it runs throughout the day and whenever you're using it. And so that's what you're getting. It's a little bit more of a pure form of air. All right, so when you have COPD, we actually see these changes occur in the airway. So you can have small changes in the smaller airways, because most of the part, in the upper part of the airway here, you're not going to get that big of a change. Those are structural, and you can have some structural damages, and that's usually caused from something else. But where we really see the COPD affecting is in the smaller airways in the lower part of the respiratory tract. And so you're going to see those changes here. So in a normal lung, you can see these expiratory airflow. It's nice and pretty, it's rounded, there's no obstruction or anything. But when you get into COPD, you can see where this alveoli here is a little bit damaged, and so it's going to constrict the amount of airflow that's happening and the ability to lock in a lot harder. There's also one form that is called alpha-1 antitrypsin. It's basically where they are missing a major protein, and so a lot of times it's referred to alpha-1, and it's inherited emphysema, essentially, and it affects the liver and can cause inherited liver disease, but it has all the sorts of other effects on the heart and on the liver and the lungs as well. So how do we do this? You can quit smoking. That is the #1 thing to do. We encourage all of our patients to quit smoking, whether they're heart patients, lung patients, whatever. Quitting smoking is one of the biggest things you can do. It is also one of the hardest things that you can do, and we understand that, but we are right here with you, and we will help you with anything that we can possibly do to help you quit smoking, whether it's working with you one-on-one with it, getting you signed up for a class once we're able to get back in classes, helping you get connected online with virtual classes that can work. There's also one, don't forget, there's 1-800-QUIT-NOW, which is NC's quit line, and so North Carolina has their own quit line in which they have counselors available 24/7, so they can help you work through all that. And when you quit, you live longer. You have decreased cough and phlegm, so you have decreased mucus. You slow your lung function, the loss of lung function, and you slow your symptom progression. And the longer that you've quit, the more likely you're reducing that risk back to normal for those that have not smoked. So as you quit sooner, you'll develop COPD later, or you might not develop it at all. And so it doesn't mean switching from cigarettes to e-cigarettes or vaping. That's still nicotine. It's still putting stuff in your lungs, still putting lots of bad chemicals in there. So keep in mind that with e-cigarettes and vaping, they have some of the same ingredients that are used to make antifreeze and formaldehyde. So you're just killing your lungs anyways. It's just another tool to do it. All right, pursed lip breathing. So we just talked about this a few minutes ago. So pursed lip breathing is in through the nose, out through the mouth, getting that good breath in. So oftentimes what we like to say is sniff the flowers and blow out the candle. So here's a pretty little picture of Alice blowing out her unbirthday cake. So in through the nose, out through the mouth. Gives you a little bit longer to have that gas exchange in the lungs, and so that you're going to get a better exchange. So what does it do for you? Improves ventilation. It releases trapped air. It keeps those smaller airways open longer because you are forcing that air out. Prolongs exhalation, so it slows your breathing rate down. It actually gives you a little bit better control over your breathing. It improves your breathing air patterns because it removes the old air and allows more new air to enter. And it relieves that shortness of breath, and it can cause you to have you some general relaxation. So one of our relaxation tools that we use is deep breathing. And we encourage you to take a nice deep breath in through the nose and then exhale out through the mouth so that you are getting that better breath control, because that is really what is important. So when should you use it? Always and forever. Okay, so pursed lip breathing, anytime that you're doing activity, anytime where you feel short of breath, we want you to use that good pursed lip breathing. So practice it, practice it, practice it, practice it. If you don't practice it, it's going to feel really awkward. And we understand that. It really does feel awkward when you first start using it, but the more that you use it, the more comfortable that you get with it, the easier it is going to be for you to use. So relax your shoulders and neck, take a nice deep breath in through the nose, and then slowly exhale it out through the mouth. So in through the nose and then, and just practice that a few times a day. At least 10 times at an hour would be ideal. Start with 4 to 5 times a day and just kind of get used to it. When you get back to class and you're in class with us, we oftentimes try to remind you. So little things, whether or not you knew them. So COPD is the 4th cause of bleeding death and soon will be the 3rd cause. Is one of the most underdiagnosed conditions in the world because people do not come in and get diagnosed for it. Women have increased significantly. Women have smaller lungs and airways and less recoil and then a lower cough threshold. 10% of people over 40 remain undiagnosed because they don't come in. They don't think that they are having issues. They just think they're out of shape. and it affects 24 million people in the world, in the U.S. And in North Carolina, it is the third leading cause of death, surpassing stroke. We are the tobacco belt, after all, as part of that. All right, so these are a bunch of inhalers. So these are some of the different medications that they might prescribe for you while you are on there. So you have your I can't talk. Your short-acting beta-agonists, your long-acting ones, your inhaled corticosteroids, and then you have the combination steroids, and then your anticholinergic. This really comes from your doctor. They look at what your symptoms are in particular, what you're having, where your respiratory rates are. Oftentimes you'll see a combination where you'll get a short-acting one as an emergency inhaler, and then you tend to have a longer-acting one that you use as a daily use. So your bronchodilators, that's what their inhalers are called, especially your asthma, your short-acting or long-acting ones. You take them in, it helps prevent wheezing, shortness of breath, and stuff like that. So it kind of gives you that quick reaction and then can have some effect over time as well. So the Combivent and Duboneb are both albuterol and ipratropium, another bronchodilator. They can be used as part of your nebulizer as well. So steroid inhalers. So these are the steroids that you can breathe in, and so they really help you feel a lot better and keeps your progression from happening too fast. And oftentimes we do see a lot of our COPD patients on steroids such as this. And then our cat here is using a spacer. So spacers are very important. They help you breathe in the medication a lot easier. And so if you need a spacer when you get back to class, just let us know. We can help you with that. Or talk to your doctor about getting a spacer. And so they do have them available with masks for those that can't put the little piece in their mouth. So the best way to take it is with that inhaler. And you can see in this picture here the difference that it can make. So when you take it without a spacer, the medication is kind of released a little bit everywhere because you're breathing in through your nose and everything like that. And so the way it's aerosolized is a little different. Versus if you use a spacer, you can see here that it keeps it well within the lungs. And so you're really going to get that medication in as much as possible that way. And they're really not that hard to use. So now my favorite topic, the other thing that you can do is pulmonary rehab. You can exercise. So exercise is very key. So what you can do every day, so it decreases your sensitization to feeling short of breath, and decreases your anxiety and depression about it, and improves your hyperinflation, and improves that musculoskeletal function. It's going to make you more efficient when you exercise. It's going to make that breathing a lot more efficient, and you're going to feel better. So just one last parting thing is just remember to breathe. So it was once believed to be a hopeless prognosis, but nowadays it's very treatable. And people with COPD can live long lives and become more active, decrease their shortness of breath, decrease their anxiety about shortness of breath, and have an improved quality of life. Thank you for listening, and I hope you guys have a great day. Bye-bye.